Have you looked at your stool lately? And I'm not talking about just in the toilet bowl, but have you actually done a stool analysis? And I'll tell you why I feel like this is one of the most important evaluation tools that need to be utilized. And I believe everyone at some point should have this done, especially if you are having any type of gastrointestinal issues, inflammatory issues, autoimmune, basically anything that is a chronic ailment in your body. Definitely, I would suggest having a stool analysis done. And I'll tell you why. So I had a patient just recently who has been seeing me for some time, and she has been improving slowly, yet just isn't quite getting to where her energy is back. Even though she's eating well, she's exercising, she's doing all of those, I guess you would say, right foundational pieces, but she's just not feeling like we would expect her to feel. So we went ahead and ran a stool analysis. And outside of imbalances in the microbiome, we found a parasite. And that specific parasite, it's called Giardia. And I'll share a little bit about it in a slide. So basically, about 15 plus years ago, she had traveled internationally and distinctly remembers that she had some local food there and drank the water and got violently ill after, with profuse vomiting, diarrhea. She was so sick. And so, did a management for the acute symptoms that she was feeling at the time, and then came home, was better, thought nothing of it. And so we ran this test, and we couldn't believe that this was still showing up in her system after all of this time. And over the years, she has done different types of anti-parasitic over-the-counter treatments, which I'm sure has helped to keep this at bay. However, it's still showing up in her system. And so one of the things that she's chronically dealing with is iron deficiency, anemia. And we have done a lot of the genetic testing. She's taking the iron supplementation. We're doing a lot of the gut balance, yet her numbers are still so low. And when we researched more deeply about Giardia, we found that one of the things that it can contribute to, especially if it is chronically in the body, is iron deficiency, anemia. And so for so many reasons, I would suggest getting a stool analysis, because on a daily basis, there are imbalances in the gut flora that can really help you to understand why you're experiencing the symptoms you do. And again, if we don't test for it, we're never going to find it. Hope this helps you. Have a blessed day.